So I'm Mieke Van Hemelrijck. I'm a reader in cancer epidemiology. So I run an academic group at King's College London, which is called Translational Oncology and Urology Research. So I run the TOR team, and we conduct predominantly clinical epidemiology projects focused on prostate cancer and bladder cancer. And in the Pioneer project, we are leading work package 2, which focuses on standardizing outcomes for men with prostate cancer. So it would be anything we want to quantify whilst we're following up men with prostate cancer with respect to a treatment or intervention that they have undergone. This could be a very clinical measurement. It could be time to death, so we could look at survival, but it could equally be about their quality of life, the actual patient experience. So there is very much two types of outcomes that one could measure. It's the very clinically relevant objective measurements to kind of monitor the treatment pathway of a patient, but equally the patient experience, the quality of life of the patients. So eventually, when we want to have guidelines to help clinicians make the right treatments for their prostate cancer patients, we have to be able to summarize all the evidence out there from all the various studies. Now, if every study was using different outcomes and different ways of measuring these outcomes, it's pretty much impossible to then come up with a quantification or a summary of the evidence out there. So it's to help standardize studies that test new treatments, interventions for prostate cancer patients so that we can then easily summarize and quantify the evidence. Yeah, so we've been going through the different type of outcomes for men with localized, locally advanced and metastatic prostate cancer. So we've gone through all the literature with respect to all the randomized clinical trials for these patients and looked at what kind of outcomes have been measured in these trials. We then also had expert meetings with various stakeholders, meaning clinicians, nurses, as well as patients, to then identify what the right terminology is for the different outcomes, because sometimes people use different types of classification mechanisms. So we're trying to kind of standardize all these different outcomes. And so what we're going to do in the next year is really try and identify what are the best definitions and measurements for these various outcomes. And we'll do that again through expert meetings with the various stakeholders. So we had a meeting in March, which was in parallel with the European Association of Urology annual meeting. And so we invited urologists, oncologists, people who deal with clinical database management, nurses, patient representatives. And then they joined us for a meeting where I would then explain to them the various outcomes that we came across. They would also send this information in advance so they could come prepared. And then we try to for each different outcome, we try to vote on or agree at least on what the right terminology was. And then afterwards, we make notes and then share that with all the stakeholders to make sure that we covered everything correctly. So it's important, obviously, we look at what has been done in the past, but and we can also think about what is the ideal situation, what is the ideal scenario, the ideal definition from everybody's point of view. But we also have to be practical. Is that data collected in the real-world evidence resources that are available for us? So that's why it's important for work package 2 to link with work package 3, because we can then check what data has already been collected, what is available. Potentially, if we want to recruit new data sources, which specific outcomes should we focus on? Can we identify a gap in terms of outcomes that is not covered yet by Pioneer? I think work package 2 is very much about collaboration, because we have to come up with a standardized set of outcomes, and there's so many opinions because there's so many stakeholders involved. So it's all about clear communication and going through the pros and cons, and then in the end remembering that it's all about the patient and making sure because of them we come up with a better set of outcomes to take forward in research.